Hi, everybody. I think we're going to wait and get started in a few minutes, but give people a few more minutes to log on if they're running late. But I see we have some folks from the medical community on campus logged on, as well as people from industrial engineering, so that's great. And there's Elizabeth from the Center for European Studies, who's co-sponsoring this talk.
Hi, Vicki, and welcome, Professor Salo. It's nice to have you here today. We're very, very happy to hear what you have to say.
Yeah, I will be very interested as well. I've been talking to Ahti a little bit by email during the pandemic, but this is a more organized way that he can share some of his thoughts and experiences. So people who just joined, I'm going to wait maybe 1 or 2 more minutes just to have fewer interruptions when we get going. So Ahti, among the audience, Oz Alagos is one of our faculty members in industrial engineering, who's been very active in modeling during the pandemic. Chris Olson and Jim Conway, both from the medical community, have been active in different capacities and very interested. So it's a great opportunity to share notes from different sides of the ocean. So it looks like the waiting has kind of died down now. Fewer people are joining, still 1 or 2 more. So I will go ahead and give the introduction, and then Ahti can give his talk. Yeah. I'm great, thanks, Jim. I'm very happy to be able to introduce Ahti Salo as our speaker today. He's a professor of systems analysis at Aalto University in Finland. He has been extremely prolific with more than 180 publications on topics such as decision analysis, resource allocation, efficiency analysis, and risk assessment. He has also been extremely prolific as an academic advisor with 26 doctoral dissertations and an extremely impressive 175 master's theses that he's supervised over the decades. So thank you for all that effort. Jane, are you going to admit all, or should I be admitting people?
Oh, I'm not seeing them anymore, Vicki.
Oh,
I'm sorry, I didn't realize that.
I will admit.
Oh, thank you.
That's okay.
My apologies.
There we go. Good thing. Apologies to people who were hung up in the waiting room in the last couple minutes. Thank you for joining. I'm just finishing up the introduction for Dr. Salo. You hopefully have read on the his impressive academic background, but the reason that he's speaking to us today with co-sponsorship from the Center of European Studies at the University of Wisconsin is because beginning in April 2020, he became a member of the COVID-19 science panel in Finland, which is advisory to the Prime Minister's office, and has been involved in pandemic planning and response advice to the government of Finland since then. So he's here not to talk about a specific mathematical model of the pandemic, but more just about his experiences in his policy role in Finland. So with that, I am happy to turn this over to Dr. Salo for his presentation, and then hopefully there will be time for questions and answers at the end. Thank you.
And many thanks indeed for this introduction. And I have entitled my talk, Reflections on Providing Science-Based Policy Advice. And with this, I wish to stress that it's not a formal assessment of whether or not the activities in Finland have been good or bad, but some perspectives. And the COVID pandemic has surely affected us all very deeply and profoundly. But for starters, I could perhaps point out where Finland is. So Finland is in Scandinavia. So here is Finland, and Aalto University is here, actually with the O letter of the word Stockholm. This is Helsinki. And as I was compiling the material for this talk, I was visiting the Johns Hopkins University site, which is one of the resources which monitors situation. And as we look at the situation in Finland, so the death toll early part of this week was 1,300. To be put into the perspective that we have a population of 5.5 million. So we are perhaps, I mean, sadly enough, we've lost lives. But one of the countries of comparison is Sweden, which has had a rather more lenient approach to the management of the COVID pandemic, especially in the early phases. And Sweden, the neighbor here, they've had 15,000 deaths, not double. The population of Sweden is approximately twice as that of Finland's. And we've had waves. These are the waves in the world. And surely enough, we've had waves in Finland, and the National Institute for Health and Welfare has been monitoring the development over the past almost 2 years now, and we can see we've had a wave. And these are the deaths. So last March was pretty sad, I would say. And it is the case that in much of Europe, the situation, despite the reasonably high vaccination rates, we are facing a situation where the death toll is unfortunately increasing. And when it comes to the utility and understanding of, let's say, modeling, and the COVID pandemic hit Finland, there was some degree of awareness in late January 2020. In mid-February 2020, rather stringent measures were being introduced, meaning that the international travel came to a halt, and it affected me as well, in the sense that I was planning to go on skiing holidays in Norway. And suddenly we just transitioned into this life of remote teaching, remote work. And one of the highly influential reports in many countries was this report by Neil Ferguson and his collaborators from the Imperial College COVID response team, published on the 16th of March 2020. And it was an analysis of the impact of non-pharmaceutical interventions, NPIs, to reduce COVID mortality and healthcare demand. And it was widely read, and I think in a sense, it may have had an impact on Boris Johnson in the UK and also the US policy in introducing these severe measures. But we've had these waves back and forth, and it's been a roller coaster ride in a sense since then, and we are not yet fully out of the roller coaster, unfortunately. And then, so some of the responsibilities that I've had here in Finland. So on the 8th of April, so the Prime Minister's office appointed a working group tasked with preparing a plan for Finland's way out of the COVID crisis and deciding on measures to deal with the aftermath. And this working group consisted of the permanent secretaries of the different ministries. So Martti Hetemäki from the Ministry of Finance was the chair. So the permanent secretary is the highest ranking civil servant and he has or she has a permanent position. So if the government changes, the permanent secretaries won't change. And Kirsi Vauhila from the Ministry of Social Affairs and Health as vice chair. And in connection with establishing this preparation group, a scientific panel was to be set up consisting of researchers and experts from different fields of expertise, including areas such as social policy, education policy, economic policy, environment and climate sciences. And the procedure by which such science panel was to be nominated, there was a round of invitations sent to the universities of Finland, so including essentially all the presidents of the different universities in Finland. Then the consortium of state research institutions, Tulanet, so governmental research institutes, and then the Finnish Academy of Science and Letters, which is equivalent to the National Academies of Science, Engineering and Medicine in the US, I believe. And the preparation group, in addition to consulting us as the science group, there were consultations with the business community, municipalities, many cities and smaller communities, civil society organizations on a broad basis. And this preparation group had the task of preparing the report. And this was a very, very challenging schedule. So already by the 31st of May in 2020, we were envisaging that we should have the post-crisis measures. And that this is now almost 1.5 years ago, okay? But it's instructive to look at how was this panel then built up. So these are the members of the science, and I think it's interesting to look at the scientific disciplines. Kristiina Salmival, a specialist in social sciences, educational sciences, then public health, represented by Olli Vapalahti, University of Helsinki, then the Finnish Institute for Health and Welfare, which is the governmental research organization reporting to the Ministry of Social Affairs and Welfare, so influential, providing the formal evidence, also in terms of epidemiological modeling. Then social policy, I won't go through the names, education policy from different universities. Then we have, I'm here, and my field in connection with this science panel was that of resilience, which is not perhaps, and I shall be revisiting what resilience means and what kinds of different meanings it may have later on during this talk. But one of the definitions which has been provided is that it refers to the ability to prepare or anticipate, plan for, absorb, sustain, and recover in order in the face of adverse events. So this is, and I would say that it also has the notion of how resilient an individual may be in the realm of, let's say, psychological strength or fortitude. So, but this would be referring to the meaning of resilience as referring to organizations or institutions. So my role was not to cover the aspect of resilience from the individual level. Then economic policy and environment and climate sciences. And additional members could have been appointed, but none were appointed. And actually, I would even like, if you wished to pose a question or remark, do you think anything is missing? And I would say that something is missing here. And the one aspect now in hindsight, which was missing in a sense, is that of law, jurisdiction. Because when it finally came to the introduction of various measures, so in a democratic society, one would always need to, can we make things such as vaccinations, can we make them mandatory? Or should it be voluntary? So these kinds of discussions did surface, and we didn't have that kind of an expertise on the panel at the time. Then some notions on resilience. I would also point out that the resilience, as defined on the previous slide, it has been widely analyzed from different perspectives, and what you can find, for instance, the Bloomberg company has been producing these winners and losers from a year ranking starting from last November. And this is a map. And what they would do, they would be taking some indicators as to what are some of the manifestations of being more resilient as opposed to being less resilient. And oftentimes these would be referring to things such as how many ICU intensive care units do we have? What is the death toll? What is the number of cases? How many tests have been administered? And so on and so on. And I would say that at the macro level, these do have the limitation in that whenever you produce these kinds of resilience rankings, you are limited to the data which is available from all the countries of comparison, so to speak. And surely enough, there are many countries where not all of the data is available. But if I look at how Finland has been faring over the past year, we are now here and this is like not extending to November, but nevertheless, so we are here. This is, so more or less, I mean, the worst ranking. And in this ranking, there were 53 countries included. So we've been among the top 12, more or less, all along. But you can see what is a striking feature of this diagram is that the rankings have been shifting hugely over the months. And as we look at it more specifically, so this is also from the viewpoint of the Bloomberg, and I'm not saying that it will be any better than any other, but only 7 countries have been among the such that they never fell to the lower part of the ranking. And actually one could also, I would be hesitant to draw the conclusion, but many of these countries have been reasonably, I mean, in quotation marks, not very big in terms of the Scandinavian countries. Sweden is the largest with a population of more than 10 million, and Finland, Norway, Denmark are more or less of equal size, close to 4 or 5 million. But there's plenty of volatility. And now looking at the situation, what could have been done? And this, I would say, are my personal evaluations, which have been, of course, influenced by what has been since then reported. There was a formal inquiry into the management of the early phases of the pandemic by, it was viewed as a major accident, which should be evaluated, just as in the case of any other major accident. One of them being, like, if I were to make a point of comparison, so the Estonia ship sank in the fall of 1994, 900 people perished in the Baltic Sea, and there was a major inquiry. A similar kind of an inquiry has been made into the management of the COVID crisis. And actually, one of the limitations, so oftentimes when there is a crisis, hopefully there is some sort of a preparedness plan. But if such a plan does exist, it also involves some risks in that then you may be thinking that actually the new crisis that you are then and here and now facing is to what you have been preparing for. Okay, and in our case, we had a strategy for how should we deal with a major influenza, so to speak, and that strategy had been developed in 2012, some 8 years previously, and it was a very strong and extensive report, but it was indeed taken that the COVID would be a flu, and flu just comes and it sticks with us. So I would say that there was an element of excessive reliance on this earlier preparedness plan. There was quite a bit of ambiguity what the government's mitigation strategy really is. Is it that of suppressing the virus, which has been the strategy in New Zealand and Australia to some extent, or is it like herd immunity, which was embraced by Sweden, for instance? There was quite a bit of sluggishness in opening up models and data resources. And I would say that this, to some extent, could be attributed to the fact that the Finnish Institute for Health and Welfare, which was the governmental research organizing, providing policy advice, many institutions of this nature were not like really, no one really knew exactly what was going on. And as a result, it would have been slightly even embarrassing to open up the limitations of the data sources and the models that they then had. And then, as is oftentimes the case, there's the commercial media. And I would say that the alarmist bad news, unfortunately, they tend to make headlines which sell more, in a sense contributing to the fact that people would be unnecessarily scared due to the risk amplification. So that was one approach. And also the difficulty which was manifest in the work of the science panel. We were supposed to look at different sectors and long-term impacts and whatever, but what is the value of human life? Can we even talk about the value of human life in a situation where we have a pandemic situation? So it's not about a single life, but the lives which would be lost as a result of the pandemic gaining momentum and killing many more people. So that logic was one of the hardest areas of really discussing. And also in the early phases, the restrictions were all at the national level. And we have some areas of Finland which are really sparsely populated. No incidents, but nevertheless, the legal framework didn't allow for the possibility of having differentiated restrictions in different parts of the country. And these are some of the, I would say that many things were done quite well, but in reality, few things are perfect. Then on the work of the science panel, so how did we, so we were appointed by the Prime Minister's office, and the work began very promptly. So we were appointed on Wednesday or Thursday. We received questions which were really like focal questions, and we were expected to deliver the answers, like a 5-page document to the Prime Minister's office by Friday. And that I call it's a prompt delivery. And I think that some of the initial answers, each and every one of us did our best. I mean, the situation was so dire that we just did contribute to the best of our ability. But then the emphasis, in a sense, shifted to developing a consensual synthesis report, which became, in the end, quite large, 115 pages. But I would say that then the challenge of synthesizing our all individual perspectives into a coherent whole proved to be somewhat of a challenge, I would say. So it involved, and actually I think that in situations like this, it might be easier to produce these individual answers and allow the policymakers to make sense of the individual answers instead of having researchers from different communities to really spend quite a bit of time seeking to have what is the consensual aspect. We did have weekly Skype meetings with the chiefs of staff. These are the permanent secretaries, so it means the same thing. And they were quite useful, but they were 40 people attending, and we did receive questions, and we did have, so one of the significance of these reports was that we did have demonstrable impacts on policies. So the recommendations as to would it be necessary to really have face masks, that changed. It wasn't previously the case. So that was actually one of the demonstrable impacts, among other things. And also another was that the schools had been in remote teaching learning mode since early April, and they were reopened in mid-May. And that was partly due to the recommendations we then had. Okay. And then I also wish to mention that I was in charge of organizing this European conference last summer in Espoo. It was a virtual conference. I was hoping to organize it already in June 2020 on campus, but nevertheless, so what I'll be discussing later will be partly, and surely enough, you can't organize a conference on risk analysis at the European level in such a situation where you don't discuss COVID-19. And we had a panel discussion, and actually Martti Hetemäki, he then retired from the Ministry of Finance as the permanent secretary, so he was on this ban. But nevertheless, so some of the reflections which I will be providing later will partly build on this conference. And these reflections include notions such as the following. And so I think that the VUCA, as referring to volatile, uncertain, complex, and ambiguous world. So many of the questions which were posed to us on the science panel, not many, but there were questions, and science wouldn't. So the scientific evidence on the nature, on the impacts of the variants, there are questions to which we cannot provide very, very definitive answers. So that is one aspect. And I already mentioned that reaching a consensus among scholars, it's not necessarily that straightforward. And if you seek to develop such a consensual perspective, the recommendations may lose some of their edge. They may become less direct and impactful. We also have scientists who are not void of political interests. This is something we need to be aware of. And I think that the time horizon for developing the exit strategy, and this was due to be crafted already in June 2020, was partly, and not only partly, but fully unrealistic. And another aspect on the work was that the workload was not very evenly distributed. So we were some 12 members on the panel, and actually I ended up being responsible for like 30 pages in a sense of the report. So And this was partly due to the kinds of questions which were posed to the panel by the chiefs of staff. Then another instrument, which I think is really, really nice and good at the moment. So, and I would say that both the science panel and also this COVID-19 research review are, in a sense, tentative approaches to forge stronger links between researchers and policymakers. So what is the rationale here? So it is to provide Finnish decision makers with up-to-date insights into science and the pandemic. It was launched in August 2020 by the Prime Minister's office, and a group of leading Finnish researchers from different fields compile and comment on the latest research findings from Finland around the world. And given that we have a population of 5 million, so most of the research on COVID takes place not in Finland, but elsewhere in the world. So I would say that mostly from other parts of the world. And how does this then, how is it organized? And what are the fields? So this is the structure of the responsibilities. So we have like sub areas of fields. So there's the one is COVID infection. How does the epidemic spread? Impacts on the population, economy and business, inequality, education, learning, technology innovations, such as various kinds of COVID passports and environment, sustainable development, international relations, EU security, people, behavioral aspects. And here I'm covering, my role is that of covering resilience and foresight. And again, I would say that the legal aspects could have been more prominent, given how important the legal framework is in setting boundary conditions as to what the government can do in the short term and the long term. And what this then means, I mean, and I would say that I'd be reading much more broadly and widely than I would ever have been reading otherwise. And I've been surfing and all sorts of foresight, because foresight is about the future at large, and even the resilience aspect in terms of being able to anticipate and recover. So all sorts of journals, and these are just like, but I would say that these are the journals I would never be reading otherwise, law reviews. But fortunately enough, law is, because I'm more of a, I mean, in a sense, mathematician by training, and in the 90s I was in charge of the first technology assessment report for the Finnish parliament. So I know how, in a sense, the legal structure, what is the architecture of crafting laws and various kinds of directives and decrees. So in a sense, that's an area I've been also covering here. And the mode of operation, how does it work? So it works in such a way that it was initially produced every 3 weeks, currently once a month. So the previous deadline was this week, now on Tuesday. 1 week before delivering the summaries, we would have a meeting with the Prime Minister's office. So there's a responsible civil servant who would be channeling some of the questions from the ministries, and oftentimes there aren't too many, because it's just like a drag now. So now the question is that we have the Omicron variant, but there's not too much scientific evidence. And for each and every one of the subfields, we would be summarizing 4 to 6 research articles, 1-page summary, and we are free to choose the ones we deem relevant, but they are to highlight the so what. You know, why should this be of importance to policymakers or civil servants in direct and understandable, accessible language? And how is it then being used? So it is sent to more than 2,000 recipients, and anyone can subscribe to this list, but it's sent to the President of the Republic, Sauli Niinistö, all ministers, more than 100 members of the parliament, civil servants in the different ministries, researchers, and the media. And I would say that actually media is important, because the media, like Helsingin Sanomat, that's the leading newspaper, and they called me once, and they were saying that this is a treasure trove, so to speak, because they get a good feel for what is happening in the world. And I think that if there is such a process of providing research reviews, which helps ensure that journalists are at the cutting edge of science, it is contributing to the national resilience. And just like now in November, there was a feedback, so a rather extensive questionnaire. So how is it being read and appreciated? So there's very strong support for continuing the activity, and it will. So now the commitment is for the next 6 months, and there was a demand for 12 months, but it's a bit of work, and as a researcher we have other things to do. So, but it will be continuing for 2022 at least. And actually what is of interest to note that the one benefit is that it may be extended to other options in the future. And what other topics that might be, I don't know. But I think that some of the tensions in the realm of foreign policy are such that there might be something, we'll see. But nevertheless, I think it has proven to be valuable enough to be continued, and also valuable enough so that it may be inspiring other uses. Then I would also, my own field, in a sense, is operations research or decision analysis. So Vicky introduced me, but I would say that we do pursue research in the same area, and the major subject which we have here at Aalto University is systems and operations research. And just like briefly summarizing what are the cornerstones or pillars of operations research. So we are dealing with systems and also decision making. So we hope to improve these systems by taking wise decisions, good decisions, which contribute to the attainment of the goals which we have for the efficiency or safety or whatever aspect which we deem to be valuable attributes of these systems. But these systems tend to be so complex that it's hard to really understand what they are about. And for that purpose, we develop models, and more specifically mathematical models. So this triangle where we have the layers of decisions, systems, and models is where much of systems and operations research takes place. And within this triangle, then we can pose questions. I mean, what is challenging from the viewpoint of building models in support of the decisions for the government? And also there are many layers. So there are these kinds of questions which are like, will people in the end obey the restrictions if we were to introduce some restrictions? And also, like, to the extent that we don't wish to or to the extent that we wish to have a comprehensive policy which in a sense seeks to establish a reasonable balance between health and the economy. So how could we assess these trade-offs? That may be a challenging issue. And then we have many kinds of uncertainties concerning the attributes of the virus. How does it spread? And especially when it comes to the new properties of the Omicron variant or whatever, they may be partly ambiguous, uncertain. And one of the layers, which I think in a sense, and also when making sense of the literature on modeling. So the one aspect is there's a profusion of models, And and I actually gave a talk at a seminar organized by the International Institute of Applied Systems Analysis. And if there's a huge range of models, then one of the challenging questions faced by the policymakers, which one out of these many models should we be trusting? And it's not an easy question, because all of these models do have their limitations and assumptions and whatever aspects. So it's not an easy question, but I would actually wish to make the case for the argument that there's a space for collaborative risk management. So the breadth of the concerns which would have to be addressed in order to cover all these aspects is so broad that no single individual has all the requisite knowledge. So there's an element of collaborative risk management. And actually, I cited this past Tuesday in the most recent research review, this one paper by Ackman on the hard lessons of shifting modeling trends, which was an assessment. I mean, how does the modeling, how do they fare? And so collaboration is one. And if I think of one of my former students, Ville Brummer, he defended his dissertation already in 2010. And then he moved to the Crisis Management Initiative, which is a conflict resolution agency established by the former president of Finland, Ahti Salo, the winner of the Nobel Prize as well. And in a sense, Ville's role at crisis management was then to develop an internal development team, which then actually resulted in the establishment of a spin-off company. So this is Ahti Salo from the Crisis Management Initiative, and this is the website if you wish to see. But nevertheless, they've developed these collaborative risk management tools, and in 2020, so there were these Kultaranta discussions. So that is Kultaranta discussions. It's like the discussions organized by the president of Finland among senior policymakers, and they had a participatory. All these discussions took place online. The situation was bad in June 2020, but nevertheless, they were able to use some of these collaborative tools in order to canalize what's happening. So it wasn't awfully fancy in terms of the mathematical modeling, but in terms of allowing the business community and the political communities to come to a shared understanding, it was an influential process. And then I could also say some words about foresight. And some of the things I think are important when seeking to develop or to prepare for the future. And actually, I took this quotation from Steve Jobs, the late Steve Jobs. So you can't connect the dots looking forward. You can only connect them looking backwards. You have to trust the dots. And this is worthwhile. And in a sense, I would wish to spend a few minutes discussing foresight methods. There are many, and this is very stylized, but nevertheless, scenario analysis, as we now see it, it was inspired by the oil crisis in the early 70s. Shell company was very, very fortuitous in the sense that they were better able to address some of the challenges, and their some of the rationales are as follows. So forecasts are not accurate. It's good to prepare for these alternative futures, but then the question is that what kinds of scenarios would be good, which out of the many, and these are some of the definitions. and I invite you to read them. I won't be covering, but nevertheless, it's a scenario, so to speak, what we envisage will happen. And a typical scenario process might look as follows. So we are looking at uncertainties, but also certainties, but oftentimes the emphasis would be placed on the uncertainties. And they might have different possible realizations, outcomes. And now the question is that what kinds of scenarios, and the scenarios would be referring, like the skeletal scenario would be referring to a combination of these outcomes. And then you would be enriching such skeletal scenarios in order to give a more tangible and compelling feel to what we mean by a scenario. And then the question is that what do these then signify? And there are various kinds of biases in thinking about. So in the area of decision sciences, there are many, many, many biases one should be wary of in terms of, and I think that it would be good to be sensitive to one's, I mean, these can be like Achilles' heel, even in one's own, extrapolating one's implicit values unduly. So when we interact with other cultures, they don't share the same ideological approaches as we do. And as a result, that is a weakness. And also, like what I would here wish to say, one aspect is that if we think of an electricity utility, and this doesn't have to do with COVID, but nevertheless, there could be the regulated electricity prices. We have some of the highest prices just now, the cold winter, and all of these would have like different outcomes. Here 4, and so each and every one of these could be viewed as a skeletal scenario, so to speak. And now the question is that as we look at how many scenarios there can be, so the sheer number of scenarios can be just huge. So on the preceding slide, so there are 4. I mean, I had 3 with 4 levels, and then 3 with 3. So there are 1,728 scenarios. And the one key implication of this is that the realized future, as we develop these preparedness plans or scenarios, most likely the realized future will differ from what we have in any one of the scenarios we have developed. And as a result, sometimes the foresighters or scenario developers are being faulted for you missed it. I mean, why didn't you develop the one scenario which actually transpired and was realized? So this is something I wish to stress and communicate. And I won't be going into much more detail about scenario analysis. I just want to point out that one of my former students, in his master's thesis, he worked on the development of the scenarios for the National Emergency Supply Organization, which is indeed in charge of maintaining and developing the security of supply, especially for items such as medication, including face masks, and oil, grain, and so on. And the results of this methodology, and also in this case, there were 10 uncertainty factors with 4 levels each. And in that case, you would have 4 to the power of 10 different scenarios. And this is more than 1 million scenarios. So this is the map. And in that case, they developed 5 scenarios, which were as comprehensive as possible, hopefully, and also as diverse as possible. And subsequently, these are the scenarios, and they just published with a former student of mine, Eva Vilkuma, who's currently at the Aalto School of Business, this approach. How can we support the generation of these diverse scenarios, and plausible meaning that the scenarios shouldn't be inconsistent in terms of the logical assumptions. Okay, then I would wish to spend the few remaining minutes on resilience. And when I finished my own dissertation at then Helsinki University, I was a postdoc researcher at the London Business School, and I still have close connections to the London Business School. And actually, I built upon this analysis presented by Julian Birkinshaw. And you can, if you wish, you can listen to his presentation. But there are levels of resilience, and actually, oftentimes when the crisis is on, the operational resilience will be referring to the ability to manage the crisis as the crisis is happening. Okay, so that is one, to keep on going, and from 1 minute to the next, but then the more important, so to speak, from the viewpoint of ensuring the long-term capabilities of resilience, is that how do we build resilience in society, structures and resources, so that when the crisis may regrettably perhaps happen, so what are the resources, what are the assumptions, what is the nature of the system which has been shaped by the strategic resilience, which allows us to go forward. And this is referring to the psychological aspects, which I haven't covered. So I'm not a psychologist. And I could perhaps point out that the transitioning to strategic resilience, so to speak, in a sense, has like some shifts of the traditional approach to alternative. And especially in government, it may be the case that there is a bureaucracy. So it's like top-down, the commands, the policymakers, in a sense, make and provide decisions. But as the crisis are unfolding, there's also need for the emergent behavior from bottom up. And in the US, there was the Hurricane Katrina, as it 2005, was it not? And I think it was infamous for the fact that the local authorities' capabilities were not being viewed as having been very effective, whereas Walmart was so. And thanks to the emergent behavior. Then the one aspect is that of making things by the book. Okay, and also in a crisis situation, it may be the case that there's a need to make sense of the situation based on your own personal understanding of the situation. So not only like following the formal dictates, but understanding your own field of responsibility, but also understanding what are the fields of responsibilities of your neighbors, and in a sense, allowing also for some self-organization to take place, subject to the plausible assumptions. And then efficiency is one, and oftentimes this may have been, and I think that many of the challenges we've had in supply chains, they have been geared towards being optimal, but optimal with regard to the prevailing lack of uncertainties. And suddenly when we had the aspect of uncertainties, so we won't be able to, reliability will be coming to the fore. We have to be prepared for different kinds of manifestations. And also in organizations, in business organizations, it's not only focused on profitability, but also the meaning. Is there a sense of purpose? Good. So these are the, and I won't be, I just invite you to listen to Julian's presentation, but I think it was a good one. And I will then proceed on two aspects. And I would provide my final reflections on the mathematical COVID modeling. And I would say that there's an ever-present need for methodological advances. And I think that if you don't make advances, you are actually sliding backwards. So, I mean, it is the very, very remit. In order to stay where you are, you need to make progress. And there are many, many interfaces between the decision and policymakers and systems, as I said, and models. But I think that one of the weaker parts is that how do we understand how people are really behaving as their contact rates or whatever are being introduced into the equation. So understanding these behavioral assumptions would be really, really needed. And also, I think that the introduction of novel methodology, and I was referring to the work of INCLUS, so actually the adoption of that participatory risk management approach. So it came from Ville Brummer's dissertation 10 years ago, and they then established the company 2015, but there's a transitioning place. And then finally, I would like to say reflections on providing policy advice, and one aspect which is somewhat, so the analytical capabilities, they are absolutely needed, they are vital, but they are not sufficient. I would say that they are a requisite condition, but they're not. And I would actually refer, I was citing the one paper on the preparedness of European countries, and there was a citation to the Global Health Security Index in 2019. And the two countries which were the strongest in this Global Health Security Index were the United Kingdom and the United States. And I would say that if we look at the mortality rates of whatever, these countries have not fared the best in the, and I would say that good governance is just like absolutely essential in a sense, in terms of ensuring that both within the organizations and between the organizations. And in Finland, some of the greatest weaknesses were between the different ministries, because the ministries would have their own terrains and responsibilities, but at the margins where some of these would be overlapping. And I would say that when we'd be having like incoming flights from Italy, so they are under the dominion of the Ministry of Transportation, but suddenly then we come to the airport. So there were glitches, I would say. And then I would say that when we come to understanding research or the impact of research in society, so we are incentivized largely. So we're being measured by the number of papers we produce, but less so for making sense of the broader research landscape. And I've been, in a sense, thankful for my role on this research review, because I've been forced. I mean, I could have written more papers, I mean, in my specialization, but I had to make sense. And as we make sense of the research landscape, there are two aspects which make it challenging. And one of them is that journals of lesser quality tend to publish results faster. Is it good or bad? So that's one. It takes more time to publish in the best journals. And then from the research perspective, it's hard to produce really solid research if the operational crisis is on. I mean, the business, I mean, the policymakers are just like they don't have any bandwidth for anything else than the actual day-to-day management of the crisis. So you can't like devote hours and hours in order to, let's have this controlled case study. No way. We just have to survive. But finally, I would say that I've been thankful for the fact that I've been contributing in my own humble way to the national efforts towards conquering the pandemic. And from that perspective, it's a very fulfilling duty professionally. And I find it very, very rewarding to have been in a position to interact with chiefs of staff, for instance, on debating and also seeing the limitations of science and understanding or coming to some, we as scientists. So where do we draw the line where we make promises as to what science is saying? And where do we say that actually science at this moment in time is not yet right to answer all of these questions? So with this, I very much thank you for your attention, and I would be happy to discuss anything I may have presented or even more broadly. So thank you.
Thank you very much, Dr. Salo. I know that some people may need to log off if they have other commitments at 1 o'clock here in Madison, but Ahti has agreed to stay on the line to deal with questions. And I see there is one hand ready from Catherine Adams. Do you want to ask something? Looks like that hand got taken down.
I was just clapping.